Hey guys, my name is Don Lupka. Today we're going to be going over feed additives and beef production. So before we get into feed additives, I just want to go over some important terms or some important extras when we talk about feed additives. The first one of those is going to be VFD, or commonly known as Veterinary Feed Directive. So this is, as per the FDA, VFD is a written, nonverbal statement issued by a licensed veterinarian in the course of a veterinarian's professional practice that authorizes the use of a VFD drug or combination VFD drug in or on an animal feed. So this is basically saying that VFD is just a vet's written approval to use a drug on an animal or in an animal's feed, and we'll learn shortly why that's important and why it affects feed additives. And then the next term that is important to know is withdrawal period. So just like with our other shots that we give or vaccinations, there's a withdrawal period in them with feed additives as well. So withdrawal period is simply just a period of time from when the drug is administered to when the drug's concentration falls below a allowed tolerance. During this period, animals treated with the drug should be withheld from sale or slaughter. Every approved livestock drug has a withdrawal time, which applies to when the drug is used according to the labeled directions. So just going over some more about VFDs real quick. I got the definition there up top, and then have three dates there listed on the PowerPoint. The most important date, though, the one that's the most important to remember, is that January 1st, 2017. This is when it became mandatory that all feed grade antibiotics were to require a VFD. So if we had a feed grade antibiotic that we're going to use as a feed additive like Tylen, we now need to get a vet's written order or approval to be able to administer that into the animal's feeds. This is important because, like you've all probably heard, at some point or another, antibiotic resistance is starting to become more of a concern, and we're trying to figure out ways that we can limit that from happening. This is one of those ways that we're trying to help fight antibiotic resistance is by implementing these VFDs to make sure we aren't abusing certain antibiotics in our animal feeds. And then I won't go too in depth on this slide as well. This is just some more about what happened and what's now required as of January 1st, 2017. So that valid VCPR, that is short for veterinary client patient relationship. So just that relationship, having that set up relationship with your veterinarian. And then just the rest of the bullet points here, just more general stuff. I'm not going to go too in depth on that. And then here are just some common feed additives that you'll see used that require a VFD. So I'm not going to go through and name them all off because y'all are able to read. So the important things to know though is on our left we have our combination products. So these are going to be our feed additives that have multiple active ingredients in them. And then on our right we have our single products. So those are going to be our products that only have one singular active ingredient. And then here are some more feed additives, except on the flip side, these are additives that don't require you to get a VFD. So these don't require you to get that written approval from a veterinarian to feed to your animals. I have them all listed out there as a generic name. And then within the parentheses, those are going to be more of the brand name. So for example, Monensin's the generic name, but Rumensin is the brand name for it, but it's the same thing at the end of the day. Now we can start getting more in depth into the different types of feed additives. So our main feed additives that we're going to be looking at are going to be our ionophores, our coccidiostats, antibiotics, hormones, and beta agonists. And all these can be broken down into different types. So we got our type A, B, and C types of feed additives there. And then one thing I just want to mention real quick is a lot of these additives, we have to meet a certain milligram a head a day for them to be effective. So just for an example, MGA, which is a hormone type feed additive, if we don't meet that 0.5 milligrams per head per day, whenever that female is eating her feed, then it's simply just not going to work. So on a lot of these, we have to meet a certain amount fed per day for that feed additive to actually even be effective. So first up, we got our ionophores. This is arguably probably one of the more common feed additives that you'll see being used. It was found in a study back in 2016 that around 90 and 97% of feedlots actually use an ionophore in their finishing diets. It's also been found that monensin, which is pictured there on the slide, is able to improve feed efficiency by 6.4% with an average daily gain increase of 2.5%. We find that this is largely due to a decrease around 3% in our feed intake. And these ionophores, they're organic compounds that alter the movement of ions, such as our sodiums and potassium, across cell membranes and microorganisms. And they're not antibiotics in a traditional sense, as in they don't treat bacterial infections, but they do have antimicrobial properties that specifically target rumen microorganisms. So they are, in a sense, attacking those microorganisms, but not like a normal antibiotic that you would get to treat a sickness or something like that. Some common ones that you'll see in the market are being used. Rumensin is probably the most popular, taking up about 85% of that market share. We've kind of talked about that a little bit in class. Rumensin or monensin is the generic name for it. And then you got Bovatec, Catalyst, GamePro, and VMAX are some of the other common ones that you'll find being used. So just getting into a little more about how ionophores actually work. So ionophores target the bacteria that produce acetate. This gives an advantage to the bacteria that produce propionate. And this is important because propionate is actually more energetically efficient. So this overall process is what improves the energy status of the animal, which leads to greater feed efficiency. It's also worth noting too that ionophores can be fed to all classes of cattle. It's not just limited to finishing cattle. So we can feed this in our cow-calf operations. We can feed this to our stockers and backgrounders, and we can feed them lastly in the feedlot as well. And it's also worth noting too that diet quality actually plays a pretty big role in how these ionophores can actually improve performance. So the higher quality forage, we actually end up seeing less of an effect versus using low quality forages in these rations. So our next type of feed additives we got are going to be our coccidiostats. So these are a class of feed additives that are used to prevent and control coccidiosis. This is a parasitic disease caused by protozoa of the genus Emeria. Coccidiosis is a parasite disease caused by the protozoa that infect the intestinal cells of cattle. This ends up leading to a significant economic losses globally, especially in our more temperate climates. The disease can manifest in subclinical infections, resulting in that reduced growth and increased feed requirements, or in clinical cases, in diarrhea, anemia, dehydration, sometimes death. Severe cases may also cause nervous system disorders as well. Cattle end up getting coccidiosis by ingesting infected oocytes from contaminated environments. And, these parasites end up going to rapid reproduction in the intestines, damaging cells and tissues along the way, leading to blood loss, fluid loss, impaired nutrient absorption. And then these oocytes get farther shed in feces, and they are able to survive up to 2 years in favorable conditions. Some clinical signs of coccidiosis, as well as foul-smelling, watery or bloody diarrhea, weight loss, dehydration, and straining. And in some severe cases, we may get some nervous system signs like tremors, convulsions, and those leading to higher mortality rates. So to elaborate on how coccidiostats actually work, coccidiostats interfere with the development of coccidia during their life cycle in the host animal's intestinal tract. So these end up killing the parasites outright or inhibiting their reproduction or growth. And by controlling these coccidiostats prevent damage to that intestinal lining, which can lead to malabsorption, diarrhea, and secondary infections like we talked about in the slide before. And then we can break down coccidia stats even farther into both chemical and ionophore as well. So an example of our chemical coccidia stats would be like amprolum. This is a synthetic compound that's specifically designed to target coccidia versus our ionophore type like monensin. This is ionophores that also have anticoccidial activity. So these are the ionophores that are targeting that Emeria parasites in the gut, farther preventing those coccidia from spreading and developing. Next class of feed additives we got here are going to be our antibiotics. So most important thing noting with this is that these are all going to require a VFD because they are an antibiotic. Um, so like we talked about before, you're going to have to get that vet's written approval to be able to administer these. So starting off, Tylen's going to be our most abundant antibiotic that we feed, taking up about 65% of that market share. And we feed Tylen to prevent liver abscesses. So I think we touched on it just barely in class at one time, but livers actually make up a big portion of the profit we're able to make off of carcass and off of an animal. Because we export them and they're worth a good amount of money. And if we get too many abscesses on them, then they end up decreasing in value or can even end up resulting in decreasing the value of the carcass as a whole, because if they get too many abscesses, they can start adhering to other parts inside. And our next is going to be our CTC, and these are used for control of anaplasmosis, scours, and BRD. And then OTC is going to be control of mastitis in cows and pneumonia in calves. And lastly, our pulmodile is going to be control of BRD. So just briefly going over how antibiotics work. This isn't too much out of left field from what we've learned before, and that it's pretty similar to how antibiotics that you receive when you're sick work, in terms of that they kill or reduce bacteria. This case is just in the rumen because that's how it's getting administered. So for example, something like Tylen is going to attack gram-positive bacteria along with a few gram-negative, but mostly gram-positive bacteria in the rumen. And this is what ends up leading to that reduction in liver abscesses, because it's attacking those bacteria that are associated with causing those liver abscesses. And I'm not going to try pronouncing the name. I just make a fool out of myself. So if you're really interested to learn, I can send you that information. And then are like CTC and OTCs. These are both going to also attack certain kinds of bacteria in the rumen as well. So our next type of feed additive we're going to talk about is going to be our hormone feed additives. For this, there's just one type of hormone feed additive, and that's going to be our MGA. So if you've ever had a reproduction class, you've probably gotten a chance to look over some protocols for setting up cows to get in sync. And some of those protocols are going to call for the use of MGA. This is because MGA is a estrus suppressor in our females. So whenever we reduce that estrus cycle and suppress it, this is gonna keep those females from wanting to ride each other and being in heat. This results in an increased rate of gain and improved feed efficiency. We'll typically see about a 4% improvement in feed to gain. And it's important to note as well, though, like we discussed earlier, that for MGA to even work, we have to at least get half a milligram per head per day to each one of those females for it to work. This also has a 48-hour withdrawal period. So that just means we can't sell or slaughter these females within 48 hours of the last time they were given MGA. So just getting into a little bit of how MGA works. So we kind of talked about two earlier, type A, B, and C drugs. So this is going to be our type A medicated article. So getting started off, MGA is a synthetic progestin. So if you remember the presentation I gave over implants, we had our 3 different types of implants there, and progestin was one of them. MGA works in a similar fashion to that. So primarily used for that estrus suppression. which in turn leads to growth promotion. So whenever we talk about that estrus suppression, MGA mimics the hormone progesterone, which inhibits the release of gonadotropins, so our FSH and LH from the pituitary gland. This suppresses that heat and prevents ovulation from happening. So this ends up reducing behavioral stress associated with estrus. So that mounting or that added aggression you'll see in females that come into heat. And this also allows us to synchronize estrus cycles, making breeding programs more efficient. And lastly, see some improvement in feed efficiency because we are redirecting that energy from reproductive activities towards growth. And then next, in terms of growth promotion, it's simply just reducing the energy expenditure associated with repro behaviors. So this allows those cattle to allocate more energy toward weight gain and muscle development. This leads to an increase in average daily gain and improvements in feed efficiency, just overall enhancing that herd performance. So this last different type of feed additive we're going to get into today are going to be our beta agonist. So beta agonists actually kind of have a little bit of a rocky history in the U.S. for some reasons that aren't necessarily their fault. But ractopamine was the only beta agonist actually approved to be on the market until just recently. We just saw the release of an Elanco product called Experior, which uses a compound called lubigron, which is classified as a beta androgenic receptor antagonist, and has been approved by the FDA for use in beef steers and heifers fed in confinement for slaughter from the last 14 to 91 days on feed. And unlike a lot of our other feed additives that we've seen that are marketed and approved by being listed as improving that feed to gain ratio and that feed efficiency, with Experior, Elanco actually went a different route with it, and rather than marketing it for approval as saying that it's going to increase feed efficiency, they actually went and said that Experior is actually going to decrease the amount of ammonia emissions per pound of live weight and hot carcass weight. So they kind of went a little bit of a loophole around it to get this thing approved. And at the same time, it's pretty beneficial that we're going to see those increases in our feed efficiency and that feed to gain. And then getting back to our ractopamine, which has been on the market for a longer period of time, it's labeled to be fed during that last 28 to 42 days before harvest. Beta agonists have been shown to see an increase in average daily gain during this time period by 15 to 25% without an increase in feed intake at all. So getting into that little bit of that rocky history though real quick. So zilpaterol, y'all may have heard of this in some of your classes before. This used to be used widely in the US and Canada, and it's still even labeled for use by the FDA. However, it ended up getting withdrawn by the manufacturer due to some animal welfare concerns. So from my understanding of what happened is there was some random person that saw some steers or some cattle get off the trailer going into the harvest facility and noticed that some of them were lame, and they asked what they're getting fed or whatnot, and zilpaterol ended up coming up in the conversation, and they just automatically assumed that zilpaterol caused lameness. This claim's been proven false numerous times. However, though, that reputation ended up getting ruined, so we ended up seeing Zilmax get withdrawn from the market. So getting into a little bit of how beta agonists actually work. So using ractopamine as an example, ractopamine is going to bind to those beta 1 and beta 2 androgenic receptors on the surface of cells in muscle and fat tissues. These receptors are a part of the sympathetic nervous system. This regulates our fight or flight response. This is going to result in an activation of metabolic pathways. So when ractopamine binds to those receptors, it activates androlytic cyclase, which is an enzyme that increases the production of cyclic AMP inside the cell. So whenever we have those elevated CAMP levels, They act as a secondary messenger, triggering a cascade of metabolic changes. This is going to result in improved protein synthesis. So ractopamine is going to stimulate increase in protein synthesis in muscle cells, leading to increased muscle growth or hypertrophy, in other words. And this is going to result in a higher proportion of lean meat in that animal. And alongside of this, we're also going to see a reduction in fat deposition. So ractopamine is going to promote lipolysis, or a breakdown in fat in layman's term, and it's going to inhibit lipogenesis, which is the creation of fat. So this results in fat deposition being lowered in the animal, leading to an overall leaner carcass. And this is going to end up improving our feed efficiency at the end of the day, because it's redirecting those nutrients that would have gone towards fat storage or fat production towards muscle growth. This in all allows those animals to better convert feed into lean muscle mass, resulting in less amount of feed required for each pound of gain for that animal. And that's all I have for y'all today. I appreciate you listening. Here's my work cited for you. If you have any more questions, please feel free to reach out to me. I'd be more than happy to try and answer them for you.